x-rays first. So we had
okay.
8 teeth that needed to be extracted and a lot of changes. So this is actually the maxilla, the upper jaw.
Okay.
And we have, normally the bone meets all the way down through here. We have some vertical and horizontal bone loss here, a little bit of vertical bone loss here. So this tooth was extracted.
So was this the top front teeth?
Yes.
Okay.
So this is her laying on her back like this. Okay. So this tooth here was extracted.
That's the top of her mouth. Okay.
And so go on this side here. And then next we look at the big canine tooth, this tooth here, and we look at the root. And there's no decay of the root. The periodontal ligaments is this little thin line that lies around the tooth root. And everything looks fine there.
Okay.
And we're on the left side now. We were missing a tooth here.
Just
so
missing. Just, okay.
And no reactive tissue there. Everything looks fine. And actually, this premolar tooth looks absolutely normal too. And this is on the left side. So the left side actually doesn't seem to be involved with most of the chewing because this side had the least amount of pathology.
Okay.
This is the last molar, this is the 4th premolar, and this is the 1st and 2nd molar here, and everything looks normal. So we didn't have to do any extractions on this side of the mouth.
That was the upper left side. Okay.
You got it. And everything looks fantastic here. We want to see nice thin lines around the periodontal ligament. We want to see no bone loss here. Everything looks great. Okay. Now, not so much for the right side. So we're now going to be on this side here. Canine tooth. Upper right side with the dog laying on its back.
Okay.
And so this is the canine. The root looks fantastic. This is one of the bigger roots that goes up into the sinuses. So if this abscesses, it can sometimes go up and cause a sinus infection.
Okay.
But that tooth looks fantastic. Now we start to see some pathology. So this bone should be covering all the way through here. We have both vertical bone loss and horizontal bone loss. So we should have more jawbone here. But what's happened is the bacteria has eaten away at it and it's caused it to decay and rot away.
This is the upper right side.
This
where
is the upper
the
right
root was
side.
Showing,
This is right here. Okay. Actually, it's further up than that. Okay.
Okay.
So this is this tooth. We were missing the 2nd premolar. This is the 3rd premolar. And then what's happened is that bacteria has eaten away and it's starting to recess the gum. Okay, so you remember seeing that on the picture. And now we have what's called periapical abscessation, where the periodontal ligament becomes wide here and bacteria just goes right up in there and eats away. So we did extract this tooth, so this tooth is extracted.
Okay.
This 4th premolar also is extracted, and I'll show you a picture of what that looks like. Okay, and we're actually turned around. That's this one on the wrong side here. Okay, so that is the 3rd premolar. Get the 4th. Yeah. There we go. Okay, and then it's hard to see on this x-ray, but this is where the gum tissue was completely missing. So this black area here is actually abscess. So this 4th premolar and molar 1 gone, had to be extracted. By the time I extracted these 2 teeth, there was very little supporting bone for the last molar, so I had to extract that molar tooth as well.
Okay. Good thing she's got pain meds.
Exactly. She needs pain meds. And I would have recommended a fentanyl patch for her, which is a 4-day patch.
Really?
But with her history of seizures, I decided not.
Okay.
So we're doing something else instead, and I'm going to go over that with you. And she tolerated it just fine today. I wanted to give a dose today to see how she was. She's fine with it.
Okay.
Okay, so major pathology going on in the right arcade, and we had to extract this whole arcade here. Okay, so 1, 2, 3, and 4.
Okay.
And then now we go to the lower jaw. And now we're looking at it like this. So the incisors here, canines here. She has interesting canines. She's missing some bone on the inside of the tooth. So what's happened is she might have been chewing on some kind of metal and it caused wearing of the inside of the tooth. So you see this etch here. This bone should be all the way out to here, okay? But it's got a little divot there. So she wore her teeth. And she's not into the pulp cavity. This little line here is the pulp cavity.
Yeah.
When they wear away the enamel all the way into the pulp, they can get an abscess. And this is not a tooth we want to abscess because you can see it goes all the way down to where the symphysis is. There's very little supporting bone here. So with this tooth, I never extract these teeth without x-raying them first because you have very little supporting structure here.
Okay.
And sometimes if they're infected, you have very little supporting structure around that tissue that you're trying to remove. So
Okay.
it can be a very touch and go situation. So we don't have any pathology there. Okay, we are on the right side now. Okay, so
Thanks for
here.
explaining this all.
Absolutely, well, it's
Okay.
important. So canine here comes down, and then we have our first premolar, second, and third, okay, right here.
Okay.
And we have a little bit of horizontal bone loss. I'd like to see the bone mandible come up to here. But we have no effect on the periodontal ligament or the tooth roots.
Okay.
So these teeth actually stayed. No extraction there. Okay. Now, not the case here. Okay. And we are, where are we? We are here. Okay. This big tooth in the back.
Okay.
This root is very infected. So this is widening of the periodontal space and a periapical abscess. Okay? And the bone should actually come all the way up to here. So we have furcation, meaning you can have a space in between that tooth. So this tooth actually looks good. Big long roots. We had a hole there. Okay?
Wow.
The mandible should come all the way up and meet that tooth, but it's gone. Okay?
Oh, her both must have hurt.
So, yeah. So she's going to be a lot more comfortable now.
Okay.
And what I do when I extract teeth, sometimes when you go and have it done in humans, they leave the socket open. I don't do that. I actually clean out all the bacteria and debris, flush it out vigorously, and then I actually close the gum tissue.
So you suture it
Suture it close, and then it absorbs in about 2 weeks.
So it's dissolvable stitches. Okay.
But the big thing with dogs is it's a little itchy when they're healing, and some dogs will be aggressive about trying to scratch at their mouths. So I always have them in a cone for at least 2 weeks until the gums
dear.
heal.
Lily's gotta be in a cone.
Yes.
Okay.
And it's really important because if they scratch those flaps open, then they need a second surgery. We really don't want to have to do
All right.
that. And then canned food only for a good 2 to 3 weeks.
Can she stay on raw food is soft? Is that okay? Because that's what she's eating.
My only concern with that is sometimes there's more bacteria in the raw, and because we had surgery in the mouth,
Okay. I have canned food at
I
home.
prefer that.
Okay.
Because
All right.
it's processed, you're not going to have that issue.
All right. Okay.
Yeah. Okay, and then let me just show you the other side. So now we're looking over at the left side. Okay, and here we have more action, more decay. Okay, so bone loss here, and again, that should come all the way up through here. So you can see all the bone loss and all the roots starting to become exposed.
Okay.
And we had almost bone loss all the way to the tip of this root here.
Oh my gosh.
Yeah.
Is that the tooth that was showing the root?
No, the tooth that was showing the root
Was
is
the upper right,
actually,
left?
and that's why x-rays are so important.
Yeah.
Because the gingival tissue was covering this, but you couldn't see that pocket until we get in there and start probing.
Right.
But the tooth that actually you and I could see on exam
Yeah.
is this, and you can't really appreciate that. This is gum tissue that's recessed here, exposing that space, and you can see it. But without an x-ray, those other teeth would have been
Goodness.
missed.
Yeah.
So it's
That's
really
why dental
important.
x-rays are great.
They really are.
So, I mean, so she's probably not likely going to have to do another dental in 6 months or a year. Like, she's
No.
probably good with clean teeth.
I would recommend she has a cleaning. I don't think she's going to need any major oral surgery as long as we can maintain her mouth. So brushing is super important because
Okay.
within 12 to 24 hours that bacteria is going to start to come back, and then she's going to start to get plaque again.
Okay.
And that's what causes the gums to recede and all the infection to start to happen.
I'm sure
in the
she's
mouth.
never had anything in her life.
And I think that not only was she great for it, I think she's going to be feeling so much better. I've had dogs come in super aggressive with horrible gum and disease. We do extractions on them. They feel better and they're happy. Now, the ears. Clinically, okay? Clinically, the ears are looking fantastic. I
Okay.
am not getting any more swelling or hyperplasia, all those little bumpy changes in the ear. I can see all the way down to the eardrum, and they're cleaner. Now,
Is the eardrum still ruptured or is it healing?
eardrum is healed. It's not
Healed.
even healing, it's
Oh,
healed.
it's
I
done
can
healing.
see it completely now.
Okay.
And here's the thing. It was kind of nice that we did the dental so I could see down in there,
Right.
sedated. We are still growing some rods. And so what I've decided, I can send you home with Batrol today, but I think
I
I'd
have it.
rather make sure that that's what we're going to need. You have some?
I have Batrol.
Go ahead and start it until I get this back. I just
Okay.
didn't want to send you home with some and then have to change it a couple days later.
Okay.
So yeah, if you have it at home, let's start it twice a day.
Okay.
And you're cleaning with what, Tris?
Yes, it's got the ketokitas all in it. Okay.
Keep doing that.
Okay,
Do that 15 minutes before you put the base on.
okay.
Perfect.
Twice a day on Batrol.
Twice a day.
Got it. Okay.
And the swelling is down. It looks phenomenal in there, but we still have a little growth. So I want to make
Okay.
sure that we don't need to add something else orally.
Okay.
But yeah, we're waiting on that. I
So
just
we'll
printed
get the
this
rest
out
of the
for you.
culture results on
Should be
next week.
soon. Yeah,
Okay.
I just printed this out today at 3. So.
Oh, okay.
Okay.
All right. So and then, did you X-ray her hip?
I did, and I want to show you that. Let me go grab the other machine. And I'll
Oh,
show you
okay.
what that looks
Thank you.
like. No problem.
Thank you so much.
Thanks for waiting patiently.
No problem.
I apologize.
We're your last. Are we your last clients?
That's because I'm only one person.
I know.
running
I know.
around.
We love this new vet. Her name's Dr. Steyerwald. She's at Simi Valley Animal Hospital. She's so nice. She's so thorough. She's giving us a nice rescue discount. I really hope that, I really hope we can start bringing all our dogs here. I think Dr. Steyerwald has not worked with rescue groups in the past, so we gotta make a good impression. We can't mess this up for our doggies.
I can't get my portable to work. Come on back.
Oh,
and get
sure.
this ready.
Should I leave this here or bring
Yeah,
it?
leave that here.
Okay, leave it here. Okay.
Now, you have Medicam at home, yes?
I have Medicam, yeah.
Perfect.
I have a lot
Do
of
you
it.
have Lubricin too?
Yes, you have her on it already.
Okay, perfect.
Yes.
Perfect.
Which is interesting because I've never had a vet prescribe that before. Is it a new product?
Well, here's the thing. I also do a lot with horses and my own horses, and it's been available forever as Legend IV
Okay.
for horses, the
Okay.
hyaluronic acid. And for a long time, we thought it was only absorbed IV for the horse. And then they came out with this product, and it's absolutely phenomenal, and it is absorbed.
Because my friend
orally.
Chris and Karen, who are both coming here now, they both said that their dogs are on it too.
It is amazing. I actually
It's
put
like-
my horse on it, didn't tell my trainers,
Yeah.
and I stopped giving it IV, and I
Yeah.
was giving it orally, and I just wanted to see if there was any change. Like within 3 weeks, both of them, I'm like, what's going on with your horse? He's phenomenally feeling great. He, no longer feels stiff. His mobility is fantastic. He's jumping like
Oh
he
my
never
gosh,
has
this is
before.
going to be good for dogs post-op. Like, we have a lot of
It's
orthopedic.
amazing. And the thing is, for the rescues, it's kind of nice because not all the time can you always afford to do everything you want to do as far as checking liver and kidneys and things
Yeah.
like that, which scares me with Medicam.
Yeah.
But Lubricin, if I have a pet that has kidney or liver dysfunction, I put him on the Lubricin and I don't have to worry because it's safe. It's
Okay.
safe for anything.
That's great. How long has
So-
it been out for dogs? Is it
For a long time.
no other vet has ever told us about it?
It's kind of my equine niche going over
Oh.
into the small animal.
Okay.
And I use it in cats too.
Oh,
It's
okay.
awesome.
Okay.
It works across the species. They have it for humans too.
Wow.
I haven't really used it myself. So we do have a little bit of spondylosis, which is a little bit of arthritic changes in this lower back area. You can see this little bone spur here.
Okay.
And there's a little bone spur here. And what that means is that there is some instability in this lower spine.
Okay.
And so the body's way of trying to deal with that and manage it is by forming this bony proliferation here. Now that means that there is some sensitivity in the lower back.
okay.
Although she really doesn't show me much on palpation, if she starts to become sensitive there, not only will the Medicam and Lubricin help her, we can also add additional medication to help her if she starts to become uncomfortable. Okay?
In terms of I mean, there's no adopters in sight for her right now.
Mm-hmm.
But in terms if we ever get somebody interested in her, what do I need to prepare them for spondylosis?
You know, that usually doesn't cause any major demise.
Okay, so it's not like disc disease or something?
No.
Okay.
This is more of an aging change, and I don't see any evidence of that higher up, and it's just in this lower back area. So I'm not overly concerned, and I don't think it's going to inhibit her long term.
All right.
The hips, a little bit more of an issue, okay? And I'm glad we took the x-rays. So we definitely have some dysplasia. When we look at the hips, we like to see this ball joint really deeply seated in the acetabulum, which is the cup, okay? This hip conformation is much better on the right side than the left side. And this should be down here, okay? It should be more centered in the joint. And it's luxated up a little bit. We call this a subluxation. So it's not luxated out of the joint, but it's rotated, and it also is flattened here. So that's not a severe sign of dysplasia. It's more of a mild sign of dysplasia. And usually when they have that laxity, they'll start to get lots of bone spurs here. More like what you see on this model.
Okay.
But we don't have that yet.
She doesn't have that yet?
No.
Okay. And if she develops that, is it just something she'll have to be kept comfortable with?
There's a lot of pain
Lubricant.
meds, right? Pain management, anti-inflammatories, lubricants, sometimes tramadol, sometimes adequate injections. So there's a lot we can do for this. Surgery, if it's severe, okay? It's mild right now, but it can progress with time.
Okay.
Okay. It will progress with time.
Oh, my God.
Okay.
Is she going to be another long-timer and cocker?
She might. She might.
I thought her separation anxiety was her biggest problem.
Is this causing a major pain issue for her right now? I don't think so. I think it's a mild low grade, but she does have some instability here, so she is going to get some arthritis. Okay. But, you know, she doesn't have major arthritis right now.
Okay, so she'll be on the Lubricin ongoing.
Yes.
And if we can get her adopted, we'll have to tell the adopters to keep monitoring her for pain. Yeah. And keep her on the Lubricin.
And keep her weight.
Keep her weight. Her weight's good. Okay, yeah.
And if we keep her lean, it puts less stress on her joints. It'll help her long term.
Okay.
I don't think that this, being what I see here, should condemn her from being fixed. No, I really don't.
It's her separation anxiety.
And I really think that, you know, you disclose this. If they want to even talk to me and get my opinion on it. Yeah. But I really feel like she can be managed, and I don't think this is like going to be. No.
How old do you think? Are you revising her age at all? Or we were guessing her 7, but based on the teeth and.
Yeah.
Oh, you have 5.
She definitely is a little older than 5, maybe 6, maybe 7. I don't think she's terribly old. I think she's more middle aged.
So 7 is about, because that's, I think we were
7
saying.
Is probably the highest I would go with her.
Okay, because I think we were guessing 5 to 7 on the 7.
The thing is with her teeth, a lot of that is just neglect. You know? I don't think she's been taken care of.
Yeah, I'm sure she's never been to a vet ever.
No.
Prior to her coming into Camp Cocker. So, all right. Okay. Okay.
So you're going to start her on the Batrol-Odic and you're going to keep doing the tris with keto.
And in terms, she hasn't had another seizure since Wednesday night, but that
is something that's harder for adopting her out. That's probably more pressing than the hips.
Would you want her to go on potassium bromide yet?
I actually would recommend potentially that we put her on Phenobar.
Oh, you want to do that first? Okay.
Yeah, and you know, because it's tried and true, it will work right away for her. Okay. And I'm not opposed to the bromide, but usually with the bromide I have to have it compounded.
Oh, okay. I have it at home. I have 2 other dogs.
Oh, well, if you have it at home, then
I have liquid
dose for you.
Potassium bromide.
I don't want to start it just yet.
Okay.
I want to get her through the recovery period, but knowing that if she has another seizure, then let's just go ahead and start her. Okay?
All right.
I don't want to overly sedate her, and I have her, she's going to be on some Buprenex for pain. I haven't gone over that with you yet, but it's an opioid. And so that will take a little bit of the edge off, keep her, calm her.
Okay.
And I don't want her getting hemp on top of it.
Yeah, okay.
She's going to be really dazed.
Okay.
But that should help manage her at least over the weekend
Okay.
for hopefully not having a seizure.
Okay.
And then after she's a little bit recovered from a post-operative period, then we should start.
Talk about, okay.
Okay.
All right. Because I get the potassium bromide, it's liquid.
Okay.
On 1-800-PET-MEDS, it's by K-Bro-Vet.
Okay.
And my
No,
past
but
vets,
if you have some,
yeah, I have
then
some at
let me
home.
calculate a dose for you.
Yeah.
Make it easy.
It's probably similar to the other two dogs are her weight. So,
Yeah.
all right, okay, okay.
Okay.
Oh boy,
All right.
oh boy.
Rebecca, when you get a second, can you bring her
Oh,
back?
Lily. Oh my gosh, Lily.
Because I got this stupid
Lily.
hat on. Are you ready?
What happened?
She recovered from anesthesia
Really
very
fast?
quickly. She says, I'm off to the races.
Oh,
Ready to
Lily.
go.
What happened to you?
But again, no hard food, chew toys, or anything like that for at
There
least
she
2 to
is.
3 weeks.
Oh,
And I
did she
wanna
have
check her gums and
potty on
teeth.
herself? Oh, Lily. It's okay.
It's okay, we
Everybody makes potty on themselves.
It's all right, baby.
It happens. Oh, look at that. Well, look at that. You got a fancy party hat.
Because if I have to wear
Look.
it, it's got to be cute.
Yeah, it's like it's your birthday or
And
something.
the other thing I did for her, she had, because you've been
Oh.
cleaning her ears, she had like little mats there. I washed those up.
Oh, thank you. Oh, did you check her tear ducts? Remember? Ah! That's okay. There was so many things. That's okay. Look at what they did to your party hats.
I know, right?
I'm sorry, honey.
That's okay.
Okay, sweetheart.
That's okay. It happens to everybody, Lily. Everybody makes a little potty on themselves. Hi, sweetie. I love you. Okay, Lily. Tell everyone to donate to you at campcopper.com, okay? Come on. Whoops. Whoops. Oh, where are we going?
Let's go this way. Come on.
Where are we going?
Come on. You can do it.
Come on, Lily. Are you coming?
Oh, we don't know how to walk with the cone. There we go.
There we
Here we
go. Said, thank you, Dr. Shirewell. Oh, wait, are we following you? Oh, Lily.
Where are you going?
Hey, honey. Oh. Hey, sweet. We're right here. She's confused with the cone, I think.
It's okay.
It's okay, Lily.
Oh, wrong way. Doc's going the wrong way.
Oh, here we go, Lily. Yeah, look at that.
Okay.
Look at that, Lily. I love you. Okay.
So I already gave her an injection of this around 2:30. She
Okay.
can have another dose at 9 p.m. tonight.
It's oral? You
Yes.
squirt it in her mouth?
Yes.
Okay.
And this is the opioid, so it's probably going to make her a little sleepy.
Okay.
You give her 1 dose tonight and then resume it tomorrow morning after you give her a little food.
Okay, after
Okay?
food tomorrow.
And it's roughly every 12 hours.
Did you want to see the teeth?
Oh, sure. Why not? Let's. Oh my god.
Did you want to keep them?
No.
Okay.
Oh, but that's the one that's rotted. That we
Yeah,
saw.
I've
there
read it too.
too.
This is all black,
Oh my
black
God.
bacteria. Yeah.
Lily, I don't think we want to keep these.
No?
Make any sort of necklace out of them, right? That would be
We
gross.
saved them to show you guys, and you want to keep them?
Oh no, but I appreciate you showing me that.
Of course.
Oh, but I do want Sweetheart to be on Medicam too.
Okay, I have Medicam at home.
Perfect. So start that tomorrow morning.
Okay.
Okay. And then we're going to do clindamycin, and we're going to do for 2 weeks. So 2 mLs every
okay.
12 hours.
Okay.
Okay.
I usually have it in pill form, but this is easier to just squirt in.
Squirt it right in.
Should I put it in her food or after she's
I
eaten?
want you to come from the left side, because remember the right side had a lot of extractions.
Oh, okay.
And then we
Or
actually
can I put it in her food?
You can,
Stir it
but
in the
she
food.
may not want to eat because it's kind of bitter.
Oh,
so I'd
okay.
rather have you put it in her
Squirt
mouth,
it
but
in the left
do the
side.
left side. Yeah.
Okay.
And this is enough for 2 weeks.
Okay.
We have 3 bottles there.
Lily, I love you, honey.
And
I
you
love
can
you.
start her on Lucasyn tomorrow.
Okay.
And the Medicam too.
Okay.
Okay?
All right. I love you, Lily. Lily.
Yeah, if and when you do find her at home, I can put those x-rays on a desk too.
Okay.
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 She's so cute.
I know. All right.
All right.
Thank you so much, Dr. Starwell.
Let me know how things are going on Monday too. I'd like to hear from you.
So thank you, Dr. Starwell, for
She already has things to me. She's such a good girl.
thank you.
Yeah, she says I've got fresh breath now.
Oh,
Oh, Lily, you did good. You did good. She's so sweet.
she's a sweet dog.
Careful.
Okay. All right. Thank you.
No problem.
Well,
All right.
hopefully,
bandage is where the IV line was. You can take that off tonight. Yeah.
Okay. Thank you so much. Have a good weekend.
You too.
I hope
Take care.
Olive and Mouse's
I'm so sorry
dentals
to
aren't
keep
this
you
bad.
waiting.
I hope Olive and Mouse don't have as bad a teeth.
No, I don't think they look as bad.
Oh. Thank you.
All right, take care.
All right, have a nice weekend. Okay, Lily. Oh, sweetie. Oh, boy. You had a big surgery.